Hello there, and Happy New Year. My name is James Bond. I'm a health and fitness expert, and welcome to my first video blog of 2014. Today is the 7th of January 2014. Anyway, I've just seen the newspapers for tomorrow on BBC News, and they basically talked about the Chancellor, George Osborne, wanting to reduce the government's debt and made us from a budget deficit to a budget surplus. Well, this has great implications for the health of the nation. Firstly, is this good debt or is it bad debt? I would much rather the government had a budget deficit of good debt rather than trade the budget surplus. Okay, now you're probably wondering what the hell does this guy mean about good debt? I'll mention this. I'll go into this in a second because you'll see what it means for the weight of health of the nation. A bad debt is like a credit card that's out of control that you can't handle. Okay, that's a bad debt, and I don't want anyone to have one of those. What I would prefer you to have is a good debt. Now, a good debt is basically like a mortgage on a rented property. So, for example, when I was a student, we had a mortgage of £250 a month, but we used to take in £450 a month in rent. So basically, we were making a net profit of £200. A good debt makes you money, a bad debt loses you money. So basically, I'd like the government to have good debt. You know, that budget deficit should be of good debt. Which brings us to the next point. By cutting back on spending for obesity measures, they're going to end up in a terrible situation. And I'd like them to have a good debt on basically obesity measures. If they were to invest in mechanisms and systems to make sure people didn't become overweight and obese, make sure that there were basically council-run exercise and prescription schemes to help the obese. It would be a good debt because what that happens is people will be healthier, they take less time off work, there'll be less social security payments made for people who are being obese, there'll be less people suffering from diabetes, so less medication for them, less people undergoing weight loss surgery, less days off taken from work, etc., etc., etc. So I would like the government to concentrate on good debt and basically invest in the health of the nation. And good debt applies to absolutely everything. Those are my thoughts. My name is James Bond, and I hope you have a good day. Bye bye.